আজকে আমরা সিজারিয়ান সেকশন থেকে 50টি MCQ এবং উত্তর সহ দেখব। The most common indication of cesarean section worldwide is previous C-section. Which type of cesarean incision is most common? Low transverse বা হচ্ছে phalansteal. Which anesthesia is most commonly used for C-section? Spinal anesthesia. Which is the safest anesthesia for both mother and baby during cesarean? Spinal. In which condition is classical cesarean section preferred? Transversely with ruptured membrane. The most dangerous complication of classical C-section is uterine rupture in next pregnancy. Which antibiotic is routinely given before cesarean delivery? Cephalosporin, first generation. Which skin incision is cosmetically most acceptable for cesarean section? Phalansteal বা transverse. Which layer is cut first during cesarean section? Skin. The uterus is incised at which part during lower segment cesarean section? Lower uterine segment. Which of the following is an absolute indication of cesarean section? Placenta previa major. Which of the following is a relative indication of cesarean section? All of the above. Which suture material is commonly used for uterine closure in cesarean? Bicryl. Which type of uterine incision has highest risk of rupture in next pregnancy? Classical. After previous cesarean trial of labor is allowed only if previous incision was low transverse. The most common intraoperative complication of C-section is hemorrhage. The most common post-operative complication of cesarean is fever due to infection. Which prophylaxis is essential after cesarean to prevent thrombosis? Low molecular weight heparin. Which is the minimum interval advised before attempting next pregnancy after cesarean? 2 years. Which is the main maternal risk in repeat cesarean? Adhesions and bladder injury. Classical cesarean incision is made in which direction? Vertical in upper segment. VVAC stands for vaginal birth after cesarean. Which presentation after recurrent cesarean section? Breech. During C-section, bladder is pushed down by bladder flap creation. The safest uterine incision for rupture pregnancy in future pregnancies is low transverse. Which of the following is contraindicated in BVAC, previous classical scar? 27. Which drug is avoided in C-section with preeclampsia? Methyl argometrin. Which is the most common indication of emergency C-section? Fetal distress. The most common neonatal complication after cesarean delivery is respiratory distress. What is the approximate blood loss in cesarean delivery? 1000 ml. Which muscle is separated but not cut during phalansteal insertion? Rectus abdominis. Which organ is most commonly injured in cesarean? Bladder. Which is the best method to reduce blood loss during cesarean? Uterotonic drugs. What is the commonest maternal death cause after cesarean in developing countries? Sepsis. Which incision heals with last pain after cesarean? Phalansteal transverse. Which is the safest anesthesia in eclampsia case for cesarean? Spinal. Which maternal position is best for C-section surgery? Supine with left tilt. Which incision gives fastest entry in emergency cesarean? Midline vertical. Which is the safest uterine incision in obstructed labor? Classical. Which factor increases risk of placenta accreta in future pregnancies? Repeated cesarean section. Cesarean delivery rate recommended by who? 10 to 15%. Which artery is most commonly injured during C-section? Uterine artery. Which instrument is used to hold the uterine incision as green Armitage forceps? Which method reduces adhesion after repeated cesarean? Peritoneal closure. Which part of the uterus is less vascular? Lower uterine segment. Which is the most main indication of elective C-section? All of the above. Which suture technique is mostly used for uterine closure? Double layer continuous. The commonest cause of maternal morbidity after cesarean is wound infection. The safest delivery method in HIV-positive mother is elective cesarean before labor. Which factor mainly increase C-section rates worldwide? All of the above. এই তিনটা অপশনই হবে।